this country. So I don't want anyone lecturing about the safety of women. These people don't care about humans. Last week, in fact, we saw the latest example with Kennedy recklessly eliminating the CDC's recommendation for a number of critical childhood vaccinations, and very alarmingly,
a Senate hearing on public health erupted into one of the most direct rebukes yet of the nation's top health official when Senator Angela Alsobrooks accused the HHS Secretary of peddling conspiracy theories and junk science. The Maryland senator warned that recent decisions on vaccines and reproductive health are being driven not by doctors and researchers, but by ideology and political think tanks. Her remarks opened a window into a larger fight over who gets to define medical truth in America. If you value reporting that explains the science behind the headlines, subscribe to the channel and follow this story with us.
Mr. Chairman, for this hearing.
Senator Alsobrooks.
Thank you so much, Mr. Chair. I would be remiss if I didn't start by saying I heard my colleague, very passionately talk about the fact that this is about the safety of women. I want to make it clear that this administration and this secretary could care less about women, men, or children. In fact, they don't care about humans. And I want to be very clear. I could go down and delineate how that is true, but that is not the subject of today's hearing. But for the past year, we have all watched Secretary Kennedy and this administration peddle conspiracy theories and junk science to dismantle public health structures in this country. So I don't want anyone lecturing about the safety of women. These people don't care about humans. Last week, in fact, we saw the latest example with Kennedy recklessly eliminating the CDC's recommendation for a number of critical childhood vaccinations, and very alarmingly, including the flu shot. In the midst of a flu, basically a surge in a super flu, this is the moment that this man decides to eliminate the flu shot for children as a recommendation, just like with the pediatric vaccine schedule, changing the rules on FDA-approved drugs without scientific input, legitimate evidence on safety risk, or transparency will cause, we know, unnecessary fear for patients. RFK's same playbook is being used to target mifepristone, a safe and effective medication that has been approved by the FDA for over 25 years. Now, take all of the fear-mongering and truths that RFK spewed earlier last year about measles, mumps, and rubella vaccines, and take the fact that RFK agreed to reopen the case on mifepristone this fall, conducting its own very fake review of the evidence of safety and efficacy of this drug. That review was based in part on a study released last summer by the Ethics and Public Policy Center. Now, Dr. Verma, as a practicing physician, I would imagine that you read peer-reviewed research and journals fairly regularly. Is that correct?
Yes, I do.
And is the Ethics and Public Policy Center a peer-reviewed or rigorous medical journal?
It is not. That is a policy paper that you are referring to.
And in fact, EPPC's own stated mission is to, and I quote, apply the riches of the Jewish and Christian traditions to contemporary questions of law, culture, and politics in pursuit of America's continued civic and cultural renewal. Some of their recent publications include a post entitled, quote, Good Riddance, Governor Walz. Quote, another one is Liberal Women Have Abandoned Marriage. Another one, Ending Mail-Order Abortion would fulfill 3 Trump campaign promises, and the rights of women, a natural law approach. This is clearly not the work of unbiased science, but an organization with a political agenda, one based on the last publication I mentioned that promotes that women are, in their view, inferior and should submit to men. And yet their work is being cited by state attorneys general and members of this committee to roll back access to a drug that millions of women have used safely for decades. So, Dr. Verma, was EPPC's mifepristone study peer-reviewed?
It was not.
And did this study mix in data from miscarriage management and IUD insertion procedures that have absolutely nothing to do with abortion care?
It did mix in a lot of things that were not directly related, and also they were not transparent about their methods, so it's actually hard to figure out what exactly happened. Any peer-reviewed study needs to reveal their methods, their data sources. They did not do that, and so it's very unclear the specifics, but we can tell that patients that were coming to the emergency room, for example, for routine care because they couldn't get care otherwise in their communities, or patients with completely unrelated conditions were counted.
And so you're right. So this study included completely unrelated conditions as complications of mifepristone, right?
Absolutely.
And how would the inclusion of this data undermine outcomes?
It significantly over-exaggerates complication rates by, again, counting things that are not actually complications of mifepristone.
And let me ask you one other question. Time is tolling. In contrast to this sham study, can you describe the body of evidence of medical reviews and published clinical trials that reviewed the safety and efficacy of mifepristone? Sorry, so hard to say.
Yes, absolutely. We have over 100 years of high-quality, peer-reviewed data from multiple journals, multiple researchers. And based on that data, I want to highlight one thing quickly about the FDA label that was strategically left out, is that the label specifically says there has been no causal relationship between the use of mifepristone and misoprostol and any of the complications listed.
And I'll say this last thing and go. This study from this conservative think tank is not, in RFK's words, gold standard science. It is self-published, lacks transparency, cannot be replicated, is rife with conflicts of interest, and includes flawed data. I yield back. Thank you.
Senator Markey.
Thank you, Mr. Chairman. It is very difficult for me to ignore.
Alsobrooks began by responding to claims from Republican colleagues that their policies were meant to protect women. She said bluntly that the current administration has shown little concern for women, men, or children. But she quickly shifted from rhetoric to evidence, focusing on the decision to remove several childhood vaccinations from official recommendations, including the flu shot during an intense flu surge. Public health experts have warned that such moves could confuse parents and reduce immunization rates that took decades to build. To expose the problem, Alsobrooks questioned Dr. Verma, a practicing physician, about a study being used by opponents of the medication. The research came from the Ethics and Public Policy Center, a conservative think tank, rather than a medical journal. Dr. Verma confirmed that the paper was not peer-reviewed and lacked the transparency required in real scientific work. Methods and data sources were not fully disclosed, making it impossible for other researchers to replicate the results. Even more troubling, the study mixed in cases that had nothing to do with the drug, such as routine miscarriage management and IUD procedures, and counted them as complications. Dr. Verma explained that this approach dramatically exaggerates risk rates and misleads the public. In legitimate research, every variable must be clearly defined so doctors can understand what actually causes harm. That standard was not met. Such material, the senator argued, reveals an ideological mission rather than an unbiased search for medical truth. Subscribe to the channel because understanding the difference between science and politics has never been more important. The broader context of this debate is a public health system already shaken by the pandemic. Trust in vaccines and medical institutions has declined in many communities. Experts worry that removing long-standing recommendations could lead to outbreaks of diseases once nearly eliminated. The flu alone kills thousands of Americans each year, and children are among the most vulnerable. Alsobrooks emphasized that fear-based messaging can drive patients away from hospitals and clinics. When people are told that proven medicines are dangerous, they may delay care until conditions become life-threatening. Doctors in states with strict abortion bans have reported women arriving with severe complications because they were afraid to seek help earlier. The senator connected these stories to the policies now being advanced at the federal level. Her questioning also revealed how scientific language can be manipulated. Terms like complications or adverse events have precise meanings in medicine, but in political documents, they are often stretched to include unrelated situations. Dr. Verma testified that proper studies must separate correlation from causation, a principle ignored by the think tank paper. The hearing underscored the role of peer review, a process where independent experts evaluate research before publication. This system is not perfect, but it remains the best tool for catching errors and bias. By contrast, self-published reports can circulate widely without any such scrutiny, especially when amplified by officials with large platforms. Subscribe so you do not miss future hearings where these issues will continue to unfold. Alsobrooks concluded that the cited study fails every test of credible science. It cannot be replicated, hides conflicts of interest, and relies on flawed data. She warned that using such material to shape national policy endangers millions of women who depend on accurate medical information. The exchange left a clear message. The battle over healthcare in America is no longer only about budgets or access, but about the very definition of evidence. As lawmakers, doctors, and patients navigate this new landscape, the consequences will reach into every pediatric clinic and pharmacy. We will continue to follow how these decisions affect vaccination rates, reproductive health services, and public trust. Subscribe to stay with us for detailed, human-centered reporting that goes beyond the sound bites.